What is Onureg and how does it work in treating acute myeloid leukemia?
So Onureg is medication that was approved by the FDA in September 2020. It is oral azacitidine, and azacitidine is a hypomethylating agent that has been approved for a little over a decade now for the treatment of myelodysplastic syndrome and acute myeloid leukemia, or AML.
Oral azacitidine is a newer formulation of azacitidine, which had historically been given through the IV or as an injection. And so it's considered a hypomethylating agent. So it helps turn back on genes that help suppress tumor or cancer cells so they can become more active for patients with leukemia.
So Onureg is a pill form of azacitidine, but it's very different than the subcutaneous or the intravenous azacitidine. It works differently, and the approval for it has been different.
Who is typically prescribed Onureg and what stage of acute myeloid leukemia treatment is it used for?
Onureg is approved for continued therapy or maintenance therapy for adult patients with acute myeloid leukemia after undergoing intensive induction chemotherapy and for patients who go into a complete remission. However, they cannot continue with further intensive chemotherapy due to illness or if they got very sick with their initial induction cycle.
Oral azacitidine is prescribed for patients who have AML who have been treated with intensive induction chemotherapy and consolidation therapy and are in remission, and is used as a maintenance therapy to try to keep patients in remission longer and improve survival. And it's for those patients who aren't able to move it on to stem cell transplant.
So Onureg was approved based on the QUASAR study in acute myeloid leukemia. The QUASAR study included patients who are 55 years of age or older who have achieved a complete remission or complete remission with incomplete count recovery. So patients have no evidence of leukemia in their bone marrow. They had intensive chemotherapy and they received up to 1 to 3 cycles of post-remission therapy with further intensive cycles or consolidation cycles of chemotherapy. Those patients ideally should have undergone an allogeneic bone marrow or stem cell transplant, however, could not proceed whether they had comorbidities or did not find a suitable donor or did not wish to proceed with transplant. And for those patients, they were enrolled on the QUASAR study. Half of the patients got placebo and half of the patients got Onureg, which is oral azacitidine. The schedule and dosing for oral azacitidine has been a 2-week on, 2-week off dosing. So patients received those pills or tablets for 2 weeks on, 2 weeks off. And they looked at the overall survival in that study, and Onureg was approved based on about a 10-month improvement in overall survival over placebo for maintenance therapy in acute myeloid leukemia. And Onureg is, as a result of that study, became the first FDA-approved medication for maintenance therapy or continued therapy for patients with acute myeloid leukemia.
How is Onureg administered?
It's given orally, as in the name. So it's given typically daily for 14 days, and then you get a 14-day break. And so a cycle is that full 28-day period. So it's given continuously as long as it's working and people stay in remission, people are tolerating the treatment okay, and then the patients want to continue with therapy. It's just a home therapy, so typically people will come into the clinic or have their lab work monitored at least once a month, make sure it's okay to continue, that their disease is stable and still in remission, and can just take it at home.
Onureg is given as a pill or tablet for 2 weeks on, 2 weeks off. There are 2 pill strengths, so to say, a 300 milligram tablet and a 200 milligram tablet. We typically start with the fully prescribed dose, which is 300 milligrams, 2 weeks on, 2 weeks off, but that can further be reduced to 200 milligrams or sometimes a 7-day on, 3 weeks off schedule, depending on the toxicities and tolerability of each and every patient.
Is Onureg given by itself or in combination with other therapies?
So right now it's just given by itself with how it's currently approved.
No, so Onureg at this point is approved as a single agent therapy. It has no approval for combination treatments in AML at this point, and nor can it be substituted with IV azacitidine or subcutaneous azacitidine. When they looked at the pharmacokinetics, the dosing, the schedule, they vary differently, and the indications as well vary differently between IV subcutaneous azacitidine versus oral azacitidine. So Onureg alone has not really been shown to be effective to treat active acute myeloid leukemia. However, it's been shown to improve survival when it's used as maintenance therapy for patients who are already in remission but cannot undergo further intensive chemotherapy or an allogeneic bone marrow or stem cell transplant.
What are the side effects of Onureg?
For oral azacitidine, the majority of side effects are going to be gastrointestinal. So patients can experience like nausea, vomiting, diarrhea, can have effects to the taste buds. So it's typically patients are prescribed at least a nausea medicine to take an hour to 30 minutes before they take the pills each day, and then may need things like Imodium or whatnot to help with diarrhea.
So the side effect profile with Onureg is mainly gastrointestinal. As a pill, a lot of patients can have nausea, vomiting, or diarrhea, and preventative anti-nausea medications are typically prescribed with Onureg, particularly in the first 1 to 2 rounds or 1 to 2 cycles of therapy. Other side effects include myelosuppression or dropping in blood counts, and so the blood counts have to be monitored quite closely when patients are on Onureg.
Patients can also have lower blood counts like platelets, white blood cell count, and can have some joint aches and pains on the treatment.
Fatigue has also been reported with hypomethylating agents in general, such as azacitidine, and they've seen an increased rate of pneumonia or lung infections with Onureg.
If the side effects are bad enough that those things aren't helping, there are dose reductions we can do to the treatment to help patients tolerate it better.
In general, with dose modifications and preventative anti-nausea medications, many patients are able to tolerate Onureg quite well.
How long does someone with acute myeloid leukemia take Onureg?
So right now, for those patients who are in remission, who are prescribed, it's taken kind of indefinitely until we see signs of relapse, or again, if patients aren't tolerating it or just don't want to take it anymore.
So Onureg has been approved as maintenance therapy in AML. In the study, it was shown to improve survival to 25 months compared to 15 months for patients taking placebo. And so there was a 10-month improvement in overall survival. However, there was no end date as to how long patients take Onureg. So it's given for as long as it's working, and we hope it works for a very, very long time, but the average survival or median survival duration was 25 months from the start of Onureg therapy.
How is the effectiveness of Onureg monitored during treatment?
We will at least see patients before each cycle of treatment to make sure their blood counts look stable, to look and make sure that they have no signs or symptoms of relapse of disease. And so that's an ongoing thing that we do while they're on that treatment.
So ways to monitor for the disease coming back, because Onureg is given for patients who are already in remission. And the idea is that it would improve survival, and we would monitor for the leukemia growing or relapsing. And that can be done by just looking at the peripheral blood counts, monitoring for the reappearance of those leukemic blasts in the peripheral blood. Sometimes if the blood counts are low without an explanation, we would have to do a bone marrow biopsy to really assess the disease status and make sure that the leukemia has not come back.
Can Onureg cure acute myeloid leukemia?
So right now, oral azacitidine is not felt to be curative for patients with AML. It's thought to prolong remission and help people live longer. But for the majority of patients, it's felt that at some point in time, their leukemia will relapse.
So Onureg is approved as maintenance therapy to prevent the disease from coming back and prolong survival for patients with AML. It's not considered a curative option for AML, but it's really designed for patients who would otherwise undergo an allogeneic transplant, which is really the curative option for those patients with higher risk disease. Importantly, the approval really for Onureg is for patients with a high risk chromosomal abnormalities such as intermediate risk cytogenetics or high-risk cytogenetics or chromosomal abnormalities in which otherwise we would ideally want our patient to proceed with a bone marrow or stem cell transplant.
How is Onureg different than other hypomethylating agents?
The other hypomethylating agents that are approved in acute myeloid leukemia are IV or subcutaneous azacitidine, as well as decitabine.
It's not interchangeable from IV azacitidine, and it's also different from decitabine in how it's administered, so as a pill, while the other ones are not available in those formulations.
Now, comparing oral azacitidine, which is Onureg, to the IV subcutaneous form, it varies differently again in the dose administration, the dosing schedule, as well as the FDA indications.
And also just the what we call the pharmacokinetics, so how much the level gets into the bloodstream is considered a little bit less. And so you're able to give it over longer periods of time for those 14 days as opposed to the IV or injectable forms where it's typically 5 to 7 days per a 28-day cycle.
When they looked at the pharmacokinetics, meaning if you take the pill, what's the bioavailability or the rate in the blood, and they compared the 300 milligram pill of Onureg to the subcutaneous or IV azacitidine, they saw that only 11% of Onureg is in the bloodstream compared to 100% when it's given IV. So it really doesn't reach the same blood levels as the IV indication, and therefore should not be substituted or used to treat active AML. But it's the only one approved for maintenance therapy for those patients who are in remission and would benefit from receiving continued or maintenance therapy in AML.
What are the latest research and future developments surrounding Onureg?
There's a lot of interest in oral azacitidine because I think for patients' quality of life, being able to take a pill as opposed to an injectable or IV formulation is so much better. So it's being explored in combination with other agents of treatment such as venetoclax to get away again from IV formulation. And then also is being looked at in myelodysplastic syndrome as well.
So Onureg is being studied in combination therapies right now in clinical trials, as well as other settings where maintenance therapy could be employed, such as after an allogeneic transplant, or in combination with other therapies that are approved in the relapse setting for AML, such as pill-pill combination therapies, where it would be more convenient for patients to take a kind of a 2-pill combination, and just as a way to improve kind of disease outcomes. Pill therapy options in AML are kind of increasing. We've seen over the past few years a lot of oral drug approvals in AML, targeted therapies, and now Onureg is the first maintenance therapy approved in acute myeloid leukemia treatment.